All right, good afternoon, class. Welcome to Case-Based Learning. All right, so this afternoon we're going to be covering pancreatic cancer. So I hope everyone has done their readings, I assume, right?
Oh, yeah.
Totally.
Did you do it? No,
I never did it. It's fine. All right, so here's our agenda of what's going to be going down today, okay? Talking about pancreatic cancer. We're going to have an introduction for a few minutes, final exam reminders for a couple minutes. Now, you guys remember how we have to have at least an 800 on that final exam? That equates to about a 90. Then we're going to go to our case study and debrief at the end, okay?
Professor Childress, so what happens if we don't get that 800 points?
You know what? That is a great question. You know what's going to happen? We're going to put you through the summer program. Yes, for success. All right, y'all, so let's get started. Who wants to read off the description of the case study for the week?
Mrs. Smith is a 68-year-old female with a history of pancreatic cancer. She is presented to the ED with jaundice and severe abdominal pain and bloating. She is unable to sleep at night because of the pain, and when she lays in the fetal position, the pain recedes.
In pancreatic cancer, the proto-oncogene RAS is mutated into the oncogene KRAS. As the cancer progresses, the tumor suppressor genes P16, TP53, and SM84 are hypermethylated, allowing for the uncontrolled growth and development of any neoplasms that are resultant of KRAS production.
Awesome. All right, let's get started with our first question. So first we're going to do clinical manifestations. So question number 1. While taking a patient history, Mrs. Smith states that she has noticed a loss in appetite and decrease in her weight of about 10 pounds in the last month. Not good. How should the nurse respond to this? All right, go ahead and read through the questions and lock in your answer.
It's C. Ignore her statement since it's irrelevant to her other symptoms.
I said B. Record this in the patient's history as this could indicate a serious health issue.
All right, Rachel, so the answer is actually B. So tell me, why did you choose C?
So I picked C because I didn't realize that loss of appetite and weight loss were actually symptoms of pancreatic cancer, so I just assumed they were irrelevant.
Clinical manifestations of pancreatic cancer include pain in the abdomen, back, and epigastric area, anorexia, dark urine, jaundice, nausea, diarrhea, vomiting, palpable mass, ascites, Virchow's node, palpable periumbilical mass, and elevated cerebilirubin.
All right, y'all follow me? You feel me? All right, let's move on to question number 2. All right, class, the nurse palpates a mass in the upper right quadrant, and Mrs. Smith shows signs of guarding. What should the nurse do next? All right, so our answer choices. A, push harder on the mass and ask how much pain the patient feels on a 10-point scale. Attempt to grab the mass to determine its width and consistency. Make note of the mass in the chart and avoid further palpation causing pain to the patient. All right, guys, what do you think your answer is?
B. Definitely B.
So do you think the patient's going to appreciate you grabbing on that mass when they're already showing signs of guarding? If you had a tumor right here, how do you think that would make you feel? All right, Hannah, can I have you read the next scenario for our questions?
A CT scan has been ordered for Mrs. Smith, which showed a large 2 to 3 centimeter mass on the head of her pancreas, obstructing the biliary tract.
Question number 3. The surgeon determines that the tumor is resectable. What does this mean, y'all? All right, A, Mrs. Smith's mass has metastasized and is unable to be surgically removed. B, the mass is operable with hopes of the entire tumor being removed. Or C, Mrs. Smith's entire pancreas will have to be removed. All right, let's see.
It's B. If a tumor is resectable, it means that the surgeon can completely remove it.
You're right, it is B. Now that what we've defined resectable is, can any of you guys tell me what unresectable or borderline resectable might mean?
Unresectable means it cannot be removed entirely, for it is locally advanced, meaning the tumor has grown into nearby blood vessels. It can also be because it has metastasized to nearby organs. They can't be removed completely at this point. Surgery is done simply to relieve symptoms, but not to cure it.
All right, let's read the next section about pathophysiology. Can someone go ahead and read that for me?
Mrs. Smith's tumor is partially removed, and the biopsy of the sentinel node shows abnormal cell growth. After further testing, she is now diagnosed with locally advanced pancreatic cancer, stage 2B.
All right, so number 4, what does her AJCC staging of T3, N1, M1 tell us about Mrs. Smith's tumor? A, her cancer has metastasized to multiple organs. B, her cancer will likely go into remission and not return. Or C, her cancer has moved to the lymphatic system and now has reached nearby organs.
The answer is C. Her cancer has moved to the lymphatic system and now has reached nearby organs.
You can go home. You did your reading. Give me a hug. You did your reading. Y'all, this is what you should be doing, all right? You can go home now. All right, so can someone tell me what the AJCC staging is with the TNM?
The AJCC staging system is what is used to stage any tumors for all types of cancer. The T stands for the presence of a primary tumor and its size. The N stands for whether it has spread to regional lymph nodes or not, and the M stands for whether it has distantly metastasized or not. The number that is accompanying the T, N, and M correlates to which stage, 0 to 4, the cancer has progressed to. The later your stage, the more difficult it is to treat your cancer. After the surgery was unable to remove the entire tumor, Mrs. Smith agrees to begin a 4-week cycle of gemcitabine for 6 months with additional low-dose radiation therapy.
All right, so question number 5, we moved on to the treatment portion. What type of pharmacological agent is gemcitabine? Let's figure it out. A is a chemotherapeutic agent used to shrink the tumor and attempt to destroy microscopic cancer cells remaining after surgery. B is an antibiotic used to treat an infection. Or C is an antacid to control Mrs. Smith's GI symptoms. What's the answer, y'all?
I said A, chemotherapeutic to shrink the tumor and attempt to destroy microscopic cancer cells remaining after surgery.
I'm not really sure what the point of chemotherapy is, what the goal is.
Chemotherapy is the treatment used to kill cancer cells and prevent them from growing and dividing. Gemcitabine, which is a type of single-agent chemotherapy, is a common treatment for metastatic pancreatic cancer. It can be given orally or IV, and side effects include fatigue, GI discomfort, loss of appetite, hand and foot syndrome, low blood cell counts, and neuropathies. Someone on this type of single-agent chemotherapy has a prognosis of up to 6 to 7 months.
Because Mrs. Smith did not fall into the 15 to 20% of patients who can be surgically cured of pancreatic cancer, her nurse referred her to a local terminal cancer support group. Here, she met others with similar prognoses and learned strategies to maintain a healthy psychosocial well-being. Studies may not show that such support groups increase survival time, but there is evidence that it can increase their ability to cope with their diagnosis.
Cool, guys, cool. All right, great day today. We're done. Don't forget to do the post quiz and the case study when you get home. Good job, guys.